It's one of those few devices that can do so many different things and has lots of possibilities because the energy is super strong, but actually it goes deep into the skin and doesn't affect the outer surface. So you can treat your darker skin types, those with sensitive skin who have mixed ethnicities, rosacea, acne, those that are nervous about treatments, because this can do a lot of things. Because what I tell people is, to me, I'm always concerned about tight and bright. I want the skin to be, people worry about aging, right? So they're worried about their skin becoming looser and sagging, but also pigmentation, acne, uneven tone, pores, wrinkles. I mean, the list goes on. Literally, they come in one everything. So we got to make the skin tighter and brighter. How do you do that? You got to use a combination of lasers, peels, skincare, etc. This laser is my go-to deep heating. My Accutane patients all get this. Here's an example of a patient doing this treatment with laser and peel. Doing a consistent amount of it can improve scarring, improve redness, and overall pigmentation. Acne pops up again as an adult female. It's like, what's going on here with my life, and these sunspots and everything. And then you get patients like this who all of a sudden, out of nowhere, just acne pops up. So what we did was had to do a combination therapy. This is my Accutane protocol. This is putting patients on Accutane and doing Aerolase every week for the first month or two, doing it every 2 weeks thereafter, and every month once it's under control. And you're doing the Aerolase plus the Accutane plus some facials. What is the biggest thing that you noticed? She doesn't have scars. See, this is the thing. When I was a resident, I was told, you can't do peels when you're on Accutane, you can't do lasers, and I did it anyways because I found that it didn't make a difference. But what I found was those patients don't get scars if you do the treatments correct, because their epidermis is actually shorter and allows more collagen production when it's small, when it's shorter. It's like degreasing or de-epithelializing the skin before you laser it. You get a better result. So those patients like this that are doing constant peels, constant lasers that stimulate collagen while they have inflammation don't get scars. And you can see we can treat that so much earlier. You're going to make this patient wait a year before they get a scar treatment? It's crazy.
So this is Michelle Henry's patient, and this is after 3 treatments with the Neo, and marked improvement in her acne. And to what Jason was talking about, I think this is an exciting realm. We're seeing a lot of good results in deeper acne, nodulocystic acne. So we're beginning to use the Aerolase Neo a lot for these patients. And remember, the primary lesions of acne in a skin of color patient is not only your acne lesion, but it's the PIH, the melanotic macule. So until you clear that, your patient's never gonna be happy, because they're gonna still think that they have acne as long as they have that brown spot. So you've gotta get rid of that too. I said another patient, this is, Dr. Awudu. Again, this really bad looking, acne. Does have a pointer here? No, but you guys can see it on the jawline, going down to the neck. She's another PFB possibility, right? Probably shaves. Most of the, Latino African-American women who have PFB are shaving, plucking, causing more, PIH. But this again is a second treatment, beautiful result in her. And then if you can kind of look up to the tear trough area, does everybody see the little improvement in that tear trough? First sign of aging in most skin of color women is the development of a tear trough. That's another thing you should go after. You have to bring it up to your women that they're having the tear trough because of midfacial descent. And I love this laser on the tear trough area. It does a really good job. And in combination, this is the, that patient that's been treated for 10 years for melasma, and you can't get rid of it. It's just brittle melasma. You've gotten no result. So this was her with the 650 after 1 treatment. And this is not a home run result, but in someone who's had no progress with their melasma, for them to be able to get hope that this is going to clear up. And she went on to get clear.